Do you know the versatility of a foundation exercise? I'm Dr. Laurie McCauley from Optimum Pet Vitality, and I'm going to go through one with you and show you all the different ways to use it, gain information, and get great outcomes. So the first thing to know is, what's a foundation exercise? A foundation exercise is a simple thing, almost like a non-entity, that's going to become a big thing when we use it with different challenges and in different ways. So we build it to become something. So the one we're going to talk about today is cookie dance. So with cookie dance, the first rule is feet stay square. Your nose follows the cookie, no matter where I ask it to go. We're going to change your center of gravity, and we're going to get to use it as a diagnostic tool. I love it when things are I can multitask and get more information from one thing. So with cookie dance, we can use it for our post-surgical cases. So like post-cruciate, post-elbow or shoulder surgery. So once the dog knows feet stay square, nose follows the cookie, I can say cookies over here, cookies over here, cookies over here, cookies over here, and I've shifted their weight to, in this case, my left front leg. I can do the same thing by taking it further back and shifting their weight back. So I can use it as that kind of exercise. I can use it with my patients that have neurological issues, IBDD, FCE, stroke, anything like that, where I can work on their balance and proprioception, and all they're thinking about is peanut butter, cookie, cheese, meatball, yay, it's a party. And we're working with them, and they don't even know it. No conscious effort, just strengthening all their stabilizer muscles, which is exactly what we need. We can use it as a diagnostic tool. So these are some great pictures. So in this, let's go to this one first. In this picture, I said, bingo, get the cookie. And he said, can't get to it this way, but I can if I rotate, which tells me there's something upper cervical, right? He can't move in a correct manner. So then we look at this picture where I say, okay, come to the side. And he says, I'll follow with my eyes. I'll even stick out my tongue, but I can't get to the cookie. He has a lower cervical restriction. You can take it one step further. The dog that says, cookie, 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 whoa, don't want it, not worth it. Right where he flexed is where he hurts. So we can tell there's a bigger problem there than just a restriction where I can't get to it. Then, once we have normal motion and move our center of gravity, then we can change to harder and harder surfaces. So in the beginning, we can start on a nice, flat, even surface, non-slip. That's great. Then we can go to a non-stable surface, unstable surface. And we can say, okay, we can have smaller motions and then bigger motions. And I specifically used a big dog so you could see what it looks like. I can put him on the couch. Absolutely. I can put him on a bed. I can put him on a big dog bed, all different kinds of surfaces. Then we can make it harder. So in this case, I'm using Sid because he's my little athlete, and I can put him on a donut. So this is a non-stable surface with a lot more of a challenge, and he knows feet stay square, keep my balance. Much harder. Don't try that at home with a dog that's not gone through a whole bunch of other steps. Then we can say, okay, let's take a movable surface and just give it a little bit of support, just to get him used to it. So in this case, Sid has the back of the fireplace, the peanut ball's touching that, and then my knee's barely touching it. And he's doing a great job. But what about if we want a ninja? Here you go. Here's Sid, nobody's touching the ball. There's no support whatsoever. And he knows I gotta keep my feet square. So I have to shift my balance, totally use my balance, proprioception, all of my stabilizer muscles, and still get the cookie. That's a ninja. All right, I hope you had fun. I hope you learned something. I'm Dr. Laurie McCauley, and with Optimum Pet Vitality, and I'll see you next time.